Dear students, today I am going to explain about challenges arise due to congenital and occurred hearing loss. Auditory difficulties is a broader term that refers to types of hearing loss and levels of hearing loss of varying degrees from hard of hearing to total deafness. The major challenge facing students with the auditory difficulties is communication. Auditory difficulties in hearing impaired students vary widely, and based on this communication skill vary among these students. Among the conditions that affect the development of communication skills of persons with the auditory difficulties include nature and degree of deafness, degree and type of residual hearing, degree of benefit derived from amplification by hearing aid, family environment and age of onset. Age of onset plays a crucial role in the development of language. Persons with a prelingual hearing loss, that is present at birth or occurring before the acquisition of language and development of speech patterns, are more functionally disabled than those who have some degree of hearing after the development of language and speech. The problem arise in children with auditory difficulties includes the following: auditory figure ground problems, that is, children with auditory difficulties cannot pay attention if there is noise in the background. Very noisy, poor structured classrooms could be very frustrating. Auditory memory problem, that is, when a child has difficulties in memorizing the message such as directions, list or study material. Auditory discrimination problems, that is, when a child has difficulties in hearing the difference between sounds or words that are similar, for an example bat or mat. This can affect following auditory direction and reading, spelling and writing skills, among others. Auditory attention problems, when a child can't stay on listening long enough to complete a task or requirement, such as listening to a lecture in classroom. Auditory cognition problem, that is, when a child higher level listening tasks are difficult. Auditory cognition skills means drawing inferences from conversations, understanding ideas or comprehending verbal math problems, that is, require highlighted auditory processing and language levels. The auditory deficits are not identified and managed. Many students with auditory difficulties will face academic challenges. Hearing loss is considered to be the most prevalent congenital abnormality in newborn, and it's more than twice prevalent to other conditions that are screened for at birth, such as single cell diseases, hypothyroidism and penictomia and galactosemia. Fenitzo and Groomley in 1999 stated that it is one of the most common sensory disorder and is a consequence of sensory neural and or conductive malfunction of the ear. The impairment may occur during or shortly after the birth. It may be congenital or early onset. It caused postnatal by genetically factors, trauma or diseases. Children who were born with hearing loss are considered as prelingual deaf or whose hearing retardation occurred before they begin to speak. Therefore, The prelingually deaf typically was either born with hearing difficulties or lost their hearing before 1 year. Congenital hearing is also considered as prelingually. The term congenital hearing loss is referred to as hearing loss was present at birth. Since hearing loss in infants is silent and hidden, great emphasis is placed on the importance of early detection, reliable diagnosis and timely intervention. It was stated by Spickwalk et al. 2000. Even children who have mild or unilateral permanent hearing loss may experience difficulties with speech understanding, especially in a noisy environment, as well as problems with educational and psychosocial development. It was stated by Bess et al. In 1988 and Culbertson and Gilbert in 1996. Causes for congenital hearing loss. Dear students, now we discuss about the causes for congenital hearing loss. Congenital hearing loss can be caused by genetic, non-genetic factors. Genetic factors are caused by an autosomal dominant hearing loss, X-linked related to the sex chromosome hearing loss and autosomal recessive hearing loss. Let us discuss each genetic, non-genetic cause briefly. The genetic factors, which includes autosomal dominant hearing loss. It means in autosomal dominant hearing loss, a parent is a carrier of the abnormal gene causing hearing loss and passes it on to the child. In this criterion, there is at least a 95% chance that a child may get hearing loss. Next is autosomal recessive hearing loss. In this case, both parents have normal hearing and have a recessive gene. It means inactive gene which is not cause the hearing loss. In this criterion, there is at least a 25% chance that the child may get hearing loss because there is no other member having hearing loss in that family. The third one is X-linked hearing loss. In this case, the mother is a carrier of the recessive gene for hearing loss and passes to the child. The child may be affected through this cause usually. Hearing loss may happen through some genetic syndromes. Genetic syndromes includes the following example. Number one is Down syndrome. It is due to gene abnormality. Next one is Usher syndrome. It is an example for autosomal recessive. The third one is Teacher-Collins syndrome, that is autosomal dominant. Then fourth one is Cruzone syndrome, that is autosomal dominant. Then final one is Albert syndrome, it is X-linked. The next we are going to discuss about the non-genetic factors, which includes maternal infection such as rubella, cytomegalovirus and herpes simplex virus. The second one is aphasia. It means lack of oxygen to child during delivery, that is after the birth of the child. The third one is maternal diabetes, that is during the pregnancy, the pregnant woman is affected by diabetes. Then fourth one is toxin during pregnancy. Then low birth weight of the child. Then prematurity. At the time of birth, the child gets any injury. The final one is drugs or alcohol consumption. The pregnant woman using with alcohol or drugs. Then RH incompatibility. Both mother and child have a different blood group. Then birth jaundice. Then risk occurring at the time of birth. The above mentioned condition cause sensory neural hearing loss. The level of hearing loss ranging from mild to profound due to congenital hearing loss. Children with a hearing impairment are experiencing challenges in throughout their life. some of the challenges are not detected until too late, and as a result, the hearing loss become a hindrance to their life process. Children who have been affected by hearing loss in early childhood, that is, the child born with a hearing loss, are very different to children who have lost their hearing later development of speech and language. For example, the range of vocabulary and knowledge may be limited, which in turn may affect their academic achievement. Oyumi 2008 has stated that hearing impaired children tend to be visual learners, and this is difficult in an environment where much essential information is delivered exclusively by word of mouth. Challenges faced by children with hearing loss in communication. Children with mild to moderate hearing impairment may develop speech and language at thoroughly the same time as their peers. However, they might still struggle to communicate and speak normally. Children with auditory difficulties manifest language-related symptoms of hearing loss, such as responding inappropriately to questions or experiencing difficulties in articulation. The child might also have a peculiar voice, intonation, pattern of speech, or challenges with pronunciation. Soda error. It means during pronunciation of a words, they may substitute the letter, omit the letter, distort the word, addition of letter with the target word. Since they do not hear words from beginning of their life, they lack on their vocabulary. Sometimes while communicating, the child will not be able to express even if they wish to talk. When they are afraid, they will not be able to talk. Language barrier. If the child is talking in one language in home, in another in school, they will lose vocabulary, and for this reason they will not be able to communicate. Lack of parent support. It means if the parents are busy with their schedule, then the child will not have anyone to talk. The next is barrier. If they have a jaw tight and a physical disability, they are unable to talk like normal person. Trust. They have to trust people to communicate, or else they feel awkward. Lack of core and support through which they are motivated to talk. Social interaction. If the peer group, relatives keep them aside, they will stop communicate. Self-confidence. If they don't believe in themselves, they will not be able to speak grammatically and without break. Dear students, next we are going to discuss about the impact of congenital hearing loss on social and cognitive development. Children with the congenital hearing loss cannot hear the sound and also not hear their own voice. Opportunities for hearing the sound is totally denial in the case of congenital hearing loss. Due to hearing loss occurred at the birth onwards, so that the children who have congenital hearing loss do not develop their oral language from birth onwards like normal child. In some cases, children who have congenital hearing loss may get the opportunity to detect the sound through early identification and get proper intervention by well-trained education. But some of the children with hearing impairment are not able to use their opportunities related to getting awareness about sound because they miss the opportunity for early identification and early intervention. Children born with mild hearing loss do not develop their communication skills as their normal peers. Children who were born with profound hearing loss are classified as functionally deaf, and they do not develop their speech and communication skills as their normal peers, and children who are born with profound hearing loss are classified as functionally deaf and they do not develop their speech and language and communication skills without the help of the special educator. At the same time, such children facing the following difficulties: more difficulties in language comprehension, poor in reading skills, writing skills are not up their age level, inability to use their intelligence in problematic situation, poor in decision making, delayed language acquisition, insufficient in pick up the auditory social cues. Social isolation may arise due to oral communication. Okay students, now we are going to discuss about the impact of congenital hearing loss on speech acquisition. Children born with congenital hearing loss do not acquire speech comparable to their peers because they can't hear the spoken language around them. Retardation on auditory comprehension may hinder the speech development of children born with hearing loss. At the same time, without auditory clue, the child is developing their spoken language through lip reading. That is, observing the lip movement of the speaker during their speech. Acquiring speech through lip reading is a challenging task for children born with congenital hearing loss because some of the speech sounds are invisible in nature. During the production of some time, the sound production of speech does not represent the actual speech sound, that is happen only by the misunderstanding of sound lip reading. Usage of speech intelligence through suprasegmental aspect. In the suprasegmental aspect, it means it have 5 components: pitch, rhythm, stress, intonation, duration, are very difficult for children born with hearing loss. Speech intelligence means use of the speech in a valuable way. Again, it means how the person utilize their speech in a particular situation for solving the problem or taking decision for implementing the group activities or convince the team members through the speech. Getting awareness about suprasegmental aspect is another challenging task for children born with hearing loss. Difficulties related to speaking skills. It means delay in the development of speech and language are classic symptoms of hearing loss and deafness in children. Children with poor hearing might be unable to communicate because they cannot understand or may imitate spoken language. During the teaching learning process, they face difficulties in hearing and listening when there is a background noise. Even though if they wear a proper amplification device for a conversation section, they may face difficulties detecting the friction sound such as S or ish and F, and therefore they delete the sound S or ish and F sounds in their speech. In the conversation session, these children are unable to hear their own voice when they speak. Due to auditory retardation, they used very loud voice or very low voice when they speak. Children with hearing loss are not ready to participate in any activities voluntarily. Impact of poor stress on words, poor intonation or poor speaking skills, they lost their self-actualization. From the above mentioned difficulties, it is understood that speech intelligence is one of the characteristics of cognitive development. Congenital hearing impaired persons face more difficulties in implementation of speech intelligence in their lifestyle. That is, speech might be heard by child with hearing loss, but the words may not be intelligible. Hence, speech in terms of such as ability to discriminate the speech sound and ability to detect the presence of speech and comprehend or collect the information through speech or impossible for children born with hearing loss. Let us discuss about the impact of congenital hearing loss on language development. Listening and learning is naturally happen in language development of normal children. In case of children born with hearing loss, they are advised to develop their language through various modes and utilization of techniques. But it is very difficult task for them due to main reason such as no proper fitment of hearing aid, unawareness about auditory training, etc. No proper utilization or enhancing the residual power of hearing. Lack of getting appropriate intervention towards their development. Receiving training by insufficient trained person. Another consequence of a congenital hearing loss is its negative impact on vocabulary development, reading and writing. Deficiency in language skills may lead to limit the vocabulary development. Such inadequate knowledge of vocabulary may affect the reading skills and limited comprehension. Vocabulary development of congenital hearing impaired children. Children who have hearing defect have poor vocabulary development. Children with a hearing loss hear the noun words like pencil, two, rat, black more easily than action words. They have difficulties with the abstract words like beautiful, jealous and truthful. They may have a problem in understanding of functional words like a, or and an. Children with a hearing impairment face problem in understanding of words with multiple meaning. Always they produce and comprehend very simple and shorter sentences than normal hearing children. Often they have difficulties in understanding the complex sentences. Due to auditory difficulties, the children with the hearing impairment are unable to develop their writing and reading skills. Even though if the children with the hearing impairment develops their reading or writing skills through proper intervention, they face more difficulties in writing and the complex sentences. For an example, the Taj Mahal was constructed by Shah Jahan. Children with the hearing impairment cannot hear the word ending phonemes such as ed, it, yes. This will lead to misunderstanding of tense or verb, singular or use of plural, non-agreement of subject and verb, and possessiveness. Challenges faced by children with the hearing impairment in language development. Mostly, the hearing impaired children face more problem in communication. When the teacher uses normal method of teaching in their classes, children with the hearing impairment cannot understand the concept of what the teacher taught through sound because of their auditory difficulties. During the teaching and learning process, if the teacher is not concerned for their better comprehension of the children with the hearing impairment, they continue to teach when children with the hearing impairment have no idea of what is being discussed, and this may lead the child unhappy. They have a problem in reading and writing. Congenital hearing loss lead to language difficulties resulting in poor self-concept and self-actualization. Mainly, they face problem in phonology. It means study about the sound pattern. Next is morphology. It means study about the words. Then syntax. It means study about the sentence order. Then semantics. Study about the meaning of the sound, word or sentences. Pragmatics. Study about the usage of sound, word, sentences in a particular situation. So, the hearing impaired child face more problem in the process of language also. Bilingualism is a challenging for the hearing impaired. They face problem in making sentences pattern formation. Then they do not have a proper vocabulary. They face more difficulty in using tenses also. Challenges arising due to occurred hearing loss. Occurred hearing loss is caused of hearing loss happens sometime after birth. Occurred hearing loss is also known as late onset of hearing loss. Causes for occurred hearing loss. One is otitis media. It means inflammation of the middle ear or ear infection, fluid in the middle ear. The next is perforator eardrum. The perforator eardrum may be caused by untreated ear infection, head injury or blow to the ear or from poking something in the ear. The next causes is blockage in the middle ear. It is usually caused by the buildup of wax. The next causes diseases or viruses infections including meningitis, measles, mumps, chickenpox, influenza, etc. The next causes is certain drugs and medications. Then next is long-term exposure to loud noises. Next, head trauma. Then National Institute on Deafness and Other Communication Disorder. The children with acquired hearing loss often have a trouble paying attention to and remembering the information presented orally and may cope better with visually acquired information, and children may have problems carrying out multi-step directions given orally, need to hear only one direction at a time, and children may have poor listening skills, and the children needs more time to process information, and children have low academic performance, and they have a behavior problems, and they will face language difficulties, that is they confuse syllable sequences and have problems developing vocabulary and understanding language, and the children may have difficulties in reading, comprehension, spelling and vocabulary. Deterioration of speech occurs after severe hearing impairment. It may be neither instantaneously nor complete. Lost their control of loudness, and the children may be irregularities of rhythm are noted. Mainly, the children with acquired hearing loss facing more language difficulties, that is, the children face difficulties in developing the vocabulary of their own language, and children with auditory difficulties to be under-identified and underserved population. If the child has a prelingual, that is the hearing loss occurred before development of speech and language, and the hearing impairment, the more serious effect may happen in the child development. Lack in their receptive, that is language which is exist already in human being. Then the children with the hearing impairment have a problem in expressive language. Expressive language means they are unable to use their articulation for their view through the use of language. Both receptive and expressive language defect may be result in reduced academic achievement, lack of interest in teaching learning process, and they may withdraw from such situation. The children with the acquired hearing loss face more auditory difficulties, lead to language difficulties, that language difficulties lead to poor self-concept and self-actualization. Suppose if the teacher use the normal method of teaching in their class, children with the acquired hearing loss cannot understand the concept of what the teacher taught through sound because of their auditory difficulties. Children with the acquired hearing loss score very poor achievement in their academic skills until and unless they are provided with the appropriate intervention. In general, children with hearing loss achieve the grade level test lower than their normal peers. When teaching processes happen in very poor listening environment in the classroom, that may be affect the comprehension skill of children with acquired hearing loss. Hearing children listen normally, but children with acquired hearing loss are taught to listen in auditory oral approach. This task is even more difficulty for students who wear hearing aids which amplify the background noise. The next condition is the child does, however, have a problems constructing coherent sentences using proper grammar, recalling the words or similar communication problems. Disorder is not able to communicate thoughts, needs or wants at the same level or with the same complexity as his or her peers. In addition, the child often has a smaller vocabulary than his or her peers. Disorder also has significant problems in understanding what other people are saying to them. This lack of comprehension may result in inappropriate responses or failure to follow direction. Some people think these children are being deliberately stubborn or obvious, but this is not the case. They simply do not understand what is being said. Some children with this disorder have problems in understanding such specific types of terms as abstract noun, complex sentences or spatial terms. Communicates using speech and appears to understand spoken language at a level that is lower than expected for the child's general level of intelligence. The child's problems with self-expression and comprehension must create difficulties for him or her in everyday life or in achieving his or her academic goals. The child pays poor listening skills, otherwise known as having an auditory memory deficit. Due to that reason, the child uses frequent requests for repetition and have difficulties in memorizing spoken information and convey poor communication skills. Generally, the child with this disorder may not have the attention span to plan and follow through with the long-term assignments and benefits most in the highly structured environment. Children with auditory difficulties often demonstrate poor reading and spelling skills. As a result, poor note-taking skills become a characteristics as well. The children with acquired hearing loss extreme difficulties in concentrating or paying attention if background noise is present. Children with auditory difficulties have a problem in implementing long-term conversation, that is, understanding what is being said and giving inconsistent responses. Conversation on the telephone are also difficult. Conclusion: learning is acquired orally. Many children with congenital and acquired hearing loss have both receptive and expressive language difficulties because they are unable to hear the everyday conversation and environmental sound. Children with the congenital and acquired hearing loss miss a great deal of crucial information usually learned incidentally by non-hearing impaired children. The children with the hearing difficulties may overcome the problem only through proper diagnosis and proper usage of amplification devices. Systematic intervention by the teacher, parents in right time. So, dear students, I hope you will understood the challenges arise due to congenital and acquired hearing loss through my lecture. Thank you.